Hello again. My name is Dr. Ronald Popper, and I am a board-certified sleep medicine specialist and the medical director of the Southern California Pulmonary and Sleep Disorders Medical Center in Thousand Oaks, California. On a previous YouTube video, I introduced you to Provent therapy for obstructive sleep apnea syndrome. Provent is a novel, new treatment that applies positive airway pressure to the upper airway in patients with obstructive sleep apnea syndrome and prevents both snoring and sleep apnea much in the same way as nasal CPAP does, but without the necessity for wearing a mask and being tethered to an air pump. In the next few minutes, I'm going to show you how to apply Provent and also give you some tips on acclimating to wearing Provent therapy. Before applying Provent, I always advise my patients to thoroughly wash their face with soap and water, and often to take an alcohol pad or a makeup removing pad around the edges of their nose and nostrils to assure that no oils remain on their skin. This is vital because if a good seal is not made with the Provent and air leaks, Provent will not work. After your skin is thoroughly cleansed, the next step is to remove Provent from the package. This is the Provent package. Simply open it up, remove the Provent from the package, and what you will see is a round, oval, whitish area, which is the actual valve, inserted into the middle of an adhesive strip. Now, the way to apply Provent is to lower your upper lip by grabbing it with your lower lip, as follows. What this does is give you the perfect setting for applying Provent. Now, I'm going to step away from the camera for a moment, go to a mirror, which is how I always advise my patients to apply Provent. Now, it's important to line up the angle of the valve with the angle of your nostril. This tab, which appears on the outer portion of the Provent, goes towards the outer portion of your nostril. I'm going to apply Provent, and then I'm going to come close to the camera, and what I want you to pay attention to is how the valve opens and closes as I inhale and exhale. When I inhale, the valve is widely open. When I exhale, I'm really breathing through that little hole that you can see that appears in the valve. So the first thing that I'm going to do is peel the Provent off of the backing. And then I'm going to line up the angle of the valve with my nostrils, pull down on my upper lip, and apply Provent. I'm going to repeat this procedure on the opposite side. When it's applied, you want to pat it around the edges to make sure that the seal is appropriate. And you also want to put your hands around it and exhale and feel for any air leakage. Once you've assured that there's no air leakage, Provent has been applied properly. Now I'm going to come to the camera, and I want you to pay attention as I breathe in and out and watch the valve open and close. Now, once you've applied Provent, I always tell my patients to remember, the way this works is by making it difficult to exhale. You're going to feel a resistance to your breathing out through your nose. Slowly breathe in through your nose, slowly exhale through your nose. If it becomes uncomfortable, then go ahead and take a breath or two, breathe through your mouth to relieve that pressure. Then again, go back, slowly inhale, slowly exhale through your nose. Most patients are going to acclimate to this process right in my office as we're giving them a sample to try. Once you're at home and you're doing this for the first night, If you find that it's too hard to wear for the whole night, don't worry. Just take it off after an hour or two if that's the case. Try it again the next night. Every night you should be able to wear Provent for a longer period of time, and it should become progressively easier for you to wear it. Once you fall asleep, it's natural for patients to breathe through their nose. When you're awake, it may seem uncomfortable. You may breathe through your mouth if it's too uncomfortable. Rest assured, you will usually breathe through your nose once you fall asleep. Now, some patients are so congested, they're going to always breathe through their mouth. Those patients are going to need to wear a chin strap to keep their mouth from dropping open once they fall asleep. If you breathe through your mouth and you don't wear a chin strap, Provent will not work. You must breathe through your nose in order for Provent to work. In some patients, aside from a chin strap, we have to add a nasal decongestant spray or a nasal antihistamine spray to help open up their nasal passages. The combination of nasal sprays and a chin strap in those patients who have nasal congestion will probably allow them to wear Provent successfully 80% of the time. Most of my patients become fully acclimated to the use of Provent therapy and are able to wear it throughout the entire night within the first 2 to 4 days of using it at home. On rare occasion, some patients need to take up to 2 weeks to acclimate to wearing Provent. I encourage you all to continue to try Provent for at least a week or two before you give up on the use of Provent. Provent works when you wear it. So thank you once again for watching my video on the use of Provent therapy. Sleep well tonight and have a better day tomorrow.